New at 6:30, patient safety advocates tell us they are horrified by what a Como investigation uncovered.
For 17 months, patients of the University of Washington Medical Center were put at risk because the hospital repeatedly failed to keep critical drug mixing areas clean and sterile.
Como investigator Tracy Vetter has been digging into this story. And Tracy, the big question, how could this go on so long? Where's the oversight?
Well, there is oversight, Eric, or at least there's supposed to be, the State Department of Health. But we discovered that despite 2 inspections showing the UW pharmacy wasn't meeting minimum safety requirements, they continued to operate. So is the UW getting special treatment? And what about all those patients? Inside a University of Washington surgical suite, patients might feel pretty safe. The teaching hospital is rated #1 in the state in U.S. News & World Report's annual rankings, and 5th in the nation for its cancer treatments. But that's not the entire story, because from May 2014 through October 2015, the critical drugs going into surgical IVs, cancer care chemotherapy, even simple injectable steroids for joint pain were produced in university pharmacies that were so dirty they failed inspections.
I'm horrified. I'm horrified that all this is going on in a pharmacy.
We asked patient advocates Carrie and Wayne Fugate to take a look at inspection records the Como investigators discovered. In May of 2014, pharmacy inspectors from the Department of Health examined the rooms where critical drugs are mixed into IVs. It's called sterile compounding, and the rooms where they're prepared are, by law, also supposed to be sterile. They found ventilation hoods with rust and other discoloration, and grates with layers of dust and growth of some sort inside. The main sterile room had an open window leading to the active pharmacy area, and several surfaces, including ceiling and countertops, had porous and cracked surfaces that could collect dust. They found 56 drugs too old to use, drugs, cleaning compounds, and anesthesia liquids incorrectly stored. And they found pharmacy techs were mixing the critical IV drugs without adequate supervision by pharmacists. The hospital failed the inspection and was under orders to fix it within 14 days. A month later, the hospital had improved its score, fixing patient record keeping and removing all outdated drugs, but failed anyway with a rating of conditional because it wasn't keeping critical areas sterile.
So it's like no one's doing anything, so this will continue over and over again.
And it remained at that level for 16 months.
I would think it'd be time to start holding people accountable.
The Fugates became patient advocates after what happened to Carrie's son, Mark Turnage. This video was taken 5 years ago at one of their final visits. Mark had been admitted into a different hospital, not the UW, for pancreatitis and gallstones. State investigators cleared the hospital of violating any standards, but Mark developed several drug-resistant infections and died after 68 days in the hospital.
It never goes away.
No, you're a member of a club that nobody wants to be a member of.
The Fugates turned their grief into action by starting Washington Advocates for Patient Safety, and they're outraged that the UW pharmacy left patients at risk for so long.
I think that they need to fine them.
So how did the university get away with ignoring the state for so long?
If somehow that's going on, I want it to stop.
Gary Harris spent 11 years on the State Pharmacy Quality Assurance Commission, PQAC. 64 people died in 2012 after a Massachusetts pharmacy sent out hundreds of contaminated injections. Harris says it was a wake-up call, proving how critical it is that injectable drugs are sterile.
If you have a 50% chance of being around for even one more year and we kill you today, that isn't acceptable.
The next year, Washington's legislature passed stricter standards here. For the first time, many hospital pharmacies started failing inspections. Most made changes and quickly passed follow-up inspections, but some hospitals like the UW continued to fail. Harris and other Como sources say investigators were pressured to back off.
Well, it's illegal. It's patient safety, which is why we're coming after you.
In September of 2015, PQAC filed a statement of charges against the UW pharmacy, saying the alleged violations put patients' health or safety at risk. But instead of prompting the UW to change, the Como investigators found what followed were a flurry of emails, memos, and meetings between Secretary of Health John Weissman, the governor's office, and the Washington State Hospital Association, a professional and lobbying organization.
The pressure is from these organizations.
Only when the UW failed a third inspection by the Centers for Medicare and Medicaid and the feds threatened to pull its funding did the hospital pharmacy clean up its act, 17 months after the initial state inspection. Harris wasn't involved directly in the UW inspection process, but says it's symptomatic of what he says is happening with some other hospital pharmacies.
I spent 11 years and a whole ton of hours doing this, and I don't want to see that go to hell because someone says, oh, well, you're being too hard on us.
We've asked Secretary Weissman for an interview specifically to talk about the allegation of undue influence, and he's declined. His office saying that such meetings are common for feedback and do not change the department's commitment to patient safety. The Washington State Hospital Association agrees that those meetings were part of normal advocacy and did not represent undue influence. In a statement from the University of Washington, a spokeswoman says they have fully responded to the PQAC's allegations and continue to work with them.
So do we know if any patients of the UW were harmed during that time?
Well, we just don't have any evidence either way. And as former Commissioner Harris told us, in general, it's possible for patients to be harmed by such things, but he doesn't know how you would ever prove it.
Really interesting, Tracy. Thank you very much. As recently as last month, patients at the University of Washington Medical Center may have been at risk from potentially dirty drugs.
That's according to 2 new inspections by the state and the feds. Inspections prompted in part by a Como investigation. Back in May, we revealed the UW pharmacy repeatedly failing inspections of critical drug mixing areas.
Como investigator Tracy Vetter is here with her latest discovery. The state looking into a possible connection between those dirty drugs and the death of a patient. Tracy?
Well, that patient, her name is Natalie McLaughlin, a 70-year-old woman who went in for a relatively common back operation. She left with a rare and ultimately fatal meningitis infection.
My favorite really is this picture of Nat and me.
Not a day goes by Beryl Knaut doesn't think about, cry about, miss her sister Natalie McLaughlin. In 2014, Natalie was a healthy, active 70-year-old woman. She and her husband traveled extensively, spent long days on their sailboat, the Beamy. She bicycled, played in the ocean, played with her grandkids and her dogs.
I think she lived her life really well.
That May, an otherwise healthy Natalie went to the University of Washington Medical Center for elective back surgery. She had spinal stenosis, a common and painful spinal compression that comes with aging. The pain persisted, so Natalie went back for a second surgery the following month. Within weeks, Knaut says her sister began falling and showing signs of mental impairment.
She would not recognize people. I mean, she wouldn't be able to identify where she was. And then it got to the point where she became, I would say, almost catatonic.
It wasn't until September that UW doctors identified the problem. Natalie had a rare and fatal fungal infection called Pseudolisharia boydii. It caused masses on her brain and spine. She spent the next year and a half undergoing numerous surgeries, going in and out of intensive care and skilled nursing homes. Eventually, she couldn't talk, couldn't even blink her eyes.
Just to see her lose all of her capacity and become that powerless was very, very horrible.
This past February, Natalie died.
I feel deprived. I feel empty. You know, I feel a void.
In her grief, Knaut sought answers. How does an otherwise healthy woman die from a rare fungal infection? 3 months after Natalie's death, Knaut saw a Como investigation into the UW Medical Center pharmacies. We revealed that from May 2014 through October of 2015, patients were put at risk when the UW failed to keep critical drug mixing areas clean and sterile. The pharmacy failed 3 inspections by state and federal authorities. This was all happening while Natalie had her 2 surgeries, and Knaut wondered, could there be a connection?
They put her life at risk and everybody's lives at risk by being repeatedly negligent about basic patient safety standards in those pharmacies that were contaminated.
Knaut filed complaints with the State Department of Health and the federal government. Both conducted investigations this past July. FDA inspectors found 8 areas in which the UW pharmacies were deficient, all revolving around the pharmacies and their procedures to keep sterile drugs sterile. Only one of 2 DOH investigations is complete. While it found the pharmacy compounding areas were generally in compliance, it also uncovered problems that could compromise drug sterility, which puts patients at potential risk. And in a letter to Knaut, the DOH concluded there is cause for corrective action against the UW. But because so much time had passed since Natalie's fatal infection, DOH says it was unable to determine whether potentially contaminated drugs were available for patients at that time.
What do you want?
Accountability and transparency, and I want them to acknowledge what they've done.
And to some extent, the UW has done that. Representatives of the medical center declined an on-camera interview, but did agree to talk to Como about infectious diseases, including the one that killed Natalie. Infectious disease expert Dr. Tim Dellett, not one of Natalie's doctors, told us following her diagnosis of pseudoescherichia boydii, the medical center did a detailed investigation as to where this could have come from. He confirmed the deadly infection came from inside the hospital. Because no other patient got the infection, Dr. Dellett says it is unlikely that it came from medications produced within their pharmacies. He says what's most frustrating for all, they really aren't able to identify a clear source of the infection.
I think that that's the part that's hardest, is thinking it just didn't have to happen. It shouldn't have happened.
Knaut says nothing will bring back her beautiful sister, but hopes these new investigations will bring greater accountability and attentiveness to patient safety.
I just like that picture because it reminds me of our happy days in our childhood when we were all happy.
Dr. Dellett added the UW is very sorry about what occurred and acknowledged how devastating this has been for Natalie's family. As for the investigations, the UW responded to the FDA with a detailed plan for corrections, but the feds have not yet signed off on that. The DOH declined to talk to us, saying it's waiting for the results of its second investigation. Tracy Vetter, Como Investigators.